Get more on this now from Health and Human Services Secretary Alex Azar. Secretary Azar, thank you for joining us again this morning. When will the first American outside of a trial get this vaccine?
Well, George, I've got some good news for you here on Good Morning America that just a little bit ago, the FDA informed Pfizer that they do intend to proceed towards an authorization for their vaccine. So in the next couple of days, probably, as we work to negotiate with Pfizer the information doctors need to prescribe it appropriately, we should be seeing the authorization of this first vaccine. And we'll, as you just said, we will work with Pfizer to get that shipped out. And so we could be seeing people getting vaccinated Monday, Tuesday of next week.
What's left to be done?
So what they do right now, as you had in the good commentary earlier, there was really good discussion at the advisory committee yesterday, especially around issues of these allergic reactions we saw in the United Kingdom. So to put the appropriate language in there that the FDA is considering, also what's called a fact sheet for doctors. That's really an important part of just getting the doctors exactly the information they need so that as they work with their patients, they can make a very informed decision. So it's very close. It's really just the last dotting of I's and crossing of T's.
Right. So basically, the vaccine is going to be approved. It's just a question of working out the exact language going forward. And as you said, Monday or Tuesday for the first Americans to be getting the vaccine. But we're still going to be facing a huge shortfall right now. There's this news overnight that Sanofi's clinical trials are going to be delayed. That was one of the industries that the administration was counting on.
Well, we weren't counting on it in terms of getting to the projections that you and I've talked about of having enough vaccine for every American by the second quarter. The Sanofi vaccine could be an important addition and additional technology for later rounds of vaccination as one goes forward later in 2021. But, you know, we're looking at 20 million Americans being vaccinated just in the next coming weeks, up to 50 million total by the end of January. And we believe we could have 100 million actual vaccinations in arm by the end of February. And the products just keep rolling out, especially if we get to add AstraZeneca and Johnson & Johnson to our arsenal in the January, early February timeframe.
You said earlier this week that the government has an option to buy 500 million more doses from Pfizer. Why hasn't that option been exercised?
So we're actually working with Pfizer as well as Moderna to increase supplies available. It's really about the production capacity from Pfizer and Moderna. We're working to increase that. We're using our powers to help them boost their production. It's about getting commitments that they can deliver by a certain date. So that's all in process. Very optimistic about those interactions.
Does that include drawing more on the Defense Production Act?
Yeah, if we need to, we would use the Defense Production Act to assist them or get what we need. But the interactions are very cooperative. We would only use the Defense Production Act if absolutely necessary, or to assist them. You know, one thing that we can do is help our contractors jump to the front of the line in dealing with their suppliers.
So you're holding out hope for spring, maybe late spring. Meantime, we heard Dr. Redfield yesterday say for the next 60 to 90 days, more Americans are going to die each day than died in 9/11 or Pearl Harbor. What more can be done right now to bring down those deaths?
Well, George, it is actually relatively simple in terms of our own behaviors. Wash your hands, watch your distance, wear face coverings when you can't watch your distance, and be really careful about those indoor gatherings we've talked about. You know, indoor restaurants, indoor bars, household indoor gatherings with people from outside your household. You can do those things, but be careful because you're going to let your guard down. We know people let their guard down, and that's what's spreading disease right now.
Secretary Azar, thanks for your time this morning.
Thank you, George.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.